All right. Excellent. Well, hello, everybody. Welcome to our last session, I think. Today, we will be discussing scaling sustainable impact through university-based social innovation accelerators, a very exciting topic. In this session, we will reflect on Duke University's experience designing and leading interdisciplinary learning accelerators. And in these accelerators, how we have identified, assessed, and supported social enterprises and social entrepreneurs with promising innovations in a variety of fields all over the world, and how we've done this through really pioneering partnerships, including with institutions like UNICEF, USAID, and the World Economic Forum, all while actively engaging students and faculty. Thank you all for joining. We've already gotten started. We're going to hold questions until the end of our presentation, but feel free to drop them in the chat or the Q&A, and we will address them once we get to the end. So since I'm the one talking right now, I will go ahead and introduce myself. My name is Taylor Conger, and I manage the Duke UNICEF Innovation Accelerator at Duke University, which is in partnership with UNICEF. My work has primarily focused on the intersection of international development and entrepreneurship. I've developed entrepreneurial programs for the U.S. Fund for UNICEF. I've led fellowship programs at Echoing Green, which is an early stage social impact accelerator based out of New York. And I've supported budding social entrepreneurs at the Center for Social Innovation at Stanford's Graduate School of Business, and also coached and consulted with many, many social entrepreneurs around the world. I am joined today by my very esteemed colleagues, Krishna Udayakumar and Matt Nash. Krishna is founding director of the Duke Global Health Innovation Center. He is also the executive director of Innovations in Healthcare, a nonprofit co-founded by Duke, McKinsey & Company, and the World Economic Forum. That focus is to scale impact in transformative health solutions globally. You may have also seen him recently on CNN and Al Jazeera discussing the global response to the pandemic. And Matt Nash is joining us as well. He is the adjunct professor of the practice and managing director of social innovation at Duke. Matt is the phenomenal lead of the Duke UNICEF Innovation Accelerator and is an expert in social innovation globally. He teaches undergrad and grad courses at Duke University, as well as at the Stanford School of Public Policy. Matt also served as executive director for the Center for the Advancement of Social Entrepreneurship at Duke's Fuqua School of Business. And he is the founding center director of the Social Entrepreneurship Accelerator, or SEED, a USAID-funded development lab. So I'm going to pass it now to Matt, and he's going to share more about our work at Duke and our history with social innovation. So Matt, go ahead and take it away.
Yeah, thanks so much, Taylor. Good morning, good afternoon, good evening to everybody, wherever you find yourself. We're so excited to share a little bit about the context and history leading us into this work around accelerators at Duke. We've now had formal programs on social innovation and entrepreneurship at Duke for 2 decades now. So to start off with, we hosted the first global conference on social entrepreneurship education back in 2011, and we held a TEDx on the first night, and one of the speakers said something that stuck with me to this very day, which was, I dream of a day in which college students ask themselves, not what's your major, but what problem are you trying to solve? And in a lot of ways, I think that frames a lot of the work that we've been up to for the last decade since we heard that at TEDx. Now, how do we help build, students who are problem solvers, who are change makers, and how do we really advance those skills so that when they graduate, they're ready to get out in the world as active citizens, active movers, shakers, and change makers? And, I want to reflect on a great quote from Einstein that you'll see here, which is, we cannot solve our problems with the same thinking we used when we created them. And I think in no area more so than the Sustainable Development Goals do I think there's a real need for kind of innovative thought and action. We are facing problems that seem to be growing and growing, and the current array of solutions can't keep up with those. And we need to find ways to really design, develop, promote, and scale, effective solutions or approaches to addressing critical social problems. So here at Duke, our aim has been to create transformative learning environments to inspire, prepare, and support entrepreneurial leaders and scholars to address the world's most pressing problems. And we do that through a number of objectives. We think about how we serve our students, through our education mission. We think about our research mission. We think about, translation, which is actually commercializing or moving from ideas to action. And then transformation. How do we accelerate social innovations at Duke and beyond to have greater scale of impact, at least in relationship to the magnitude of the problems? So we here at Duke have kind of a broad understanding of social entrepreneurship. As a shorthand, we could think of it as the process of pursuing innovative, sustainable solutions to critical social problems. Or, we sometimes say recognizing and resourcefully pursuing opportunities to create social value. You'll see here on the slide some examples of very well-known social entrepreneurs, but we take a big tent kind of view of social entrepreneurship. And really, it's been informed by our colleague, the late Professor Greg Dees. Now, Greg was really kind of the academic pioneer of the field of social entrepreneurship. He taught the first known classes on social entrepreneurship when he was at Harvard Business School in the early 90s, based on work he originally experimented with at the Yale School of Management. And then he moved on to Stanford, where he founded the Center for Social Innovation before coming to Duke in 2001. And Greg wrote kind of the most widely cited academic definition of social entrepreneurship, which is really that social entrepreneurs are the change agents of the social sector. They create and maximize social value. They innovate, adapt, and learn, acting boldly, not constrained by a lack of resources, holding themselves accountable for the impact they're achieving, and really drawing across all sectors, looking across the traditional boundaries of private, public, and the citizen sector, really trying to achieve systemic change and sustainable improvement. And Greg really saw social entrepreneurship as a real opportunity. One of the opportunities he saw was social enterprises themselves. He saw them as learning laboratories that society could really learn from and draw upon, because they offer opportunities to create more cost-effective, sustainable, and scalable solutions. So if we think about social enterprises, they have opportunities for gathering on-the-ground data, insight, perspectives, prototyping, testing, refining, increasing desirability, viability, and scalability of innovations, testing different business models that would support their delivery, and mobilizing resources, experimenting with pathways to scale impact of early stage innovations. One of the sessions I was on last night, one of the speakers was talking about how there are solutions out there, but we need to scale them. And I think social enterprises offer an opportunity for that, and also engage the public sector and leverage ecosystems. So when Greg came to Duke in 2001, he set up a research and education center at the Fuqua School of Business here called CASE, which is the Center for the Advancement of Social Entrepreneurship. Here you say reflected their mission today to prepare leaders and organizations with the business skills needed to achieve lasting social change. And the work of CASE has really focused in four key areas, looking at the middle, the concept and process of social entrepreneurship. What are they? What are the business and legal models? What are the social capital markets and impact investing opportunities? And then on the far left, the real focus has been on scaling social impact, how you can take an innovation and scale it, not necessarily in magnitude, but how you scale the magnitude of the impact, how you grow impact. And this programming is focused not just on students, but also knowledge development for practitioners and for the field. So for example, just three key areas of research and thought leadership, next slide, have been, one is on the kind of key pathways and strategies for scaling impact, whether it's direct or indirect, through growing operations or taking on policy or other ecosystem barriers. Another key area of our research and publication has been impact investing. And so we've developed these online modules called CASE Smart Impact Capital, which impact investors and social entrepreneurs and stakeholders can learn more about impact investing. And more recently, CASE has been collaborating with the UN IDP and SDG Impact to create a Coursera MOOC on impact measurement and management for the SDGs, which I think is really relevant to our conference today. So just to pull back and reflect, since CASE was founded back in 2001, we've discovered that entrepreneurship or social entrepreneurship is perhaps too narrow of an understanding. That a bigger tent kind of concept would be social innovation, because social innovation is a domain not just of social entrepreneurs, Well, everyone can be an innovator. Everyone can find new and better ways and approaches for impact. So for example, whereas you can see here, click the case, real focus. In the last 20 years, we've seen a whole constellation of centers, initiatives, and programs arrive at Duke across different departments, schools, centers. You could see that whether it's from global health or energy to the divinity school, even there are a whole collection these days of folks, because anyone can be an innovator, anyone can be an entrepreneur. Next slide. One of the things we've done over the last 20 years is participate in lots of networks. So we're so thrilled to be joining the University Global Coalition. You can see here on the slide that the networks we've been a part of: the Ashoka U Changemaker Campus Consortium, which are all committed to advancing social innovation across their campuses. The Net Impact Global Coalition of students and professionals using their skills for sustainable social, environmental, economic impact. There's a number of competitions we've had our students in, from the Fowler Global Social Innovation, Holt Prize, Clinton Global Initiative University, and we've supported clubs on campus such as Design for America. So one of the things that we reflected starting about a decade ago is, we've had a lot of success in engaging students and, helping students kind of change their world. So part of it's changing their perceptions and understandings, whether it's, the undergraduate who launched an education initiative back home in East Africa, or the MBA who went to work with nurse social entrepreneurs, or, another student who went home to India and launched a menstrual health and hygiene social enterprise. But the challenge was, how do we have greater impact? How do we have more synergies across the university, not just with our students, but how do we work together better across these boundaries we often find ourselves in at any university, including Duke? So how might we achieve even greater impact? And so that led us to, about a decade ago, starting conversations with Krishna and his team to think about how could we collaborate. And it all came together through an opportunity from USAID, had launched the Higher Education Solutions Network, to put our thoughts and ideas together, to draw upon our research and scaling, to draw upon deep sector expertise and global health from Krishna's team and others around Duke, to launch the Social Entrepreneurship Accelerator at Duke in 2012, which was a USAID-funded development lab for scaling innovations and providing social entrepreneurs with the knowledge systems and networks needed to succeed. What was cool about this is it was the business school, it was the School of Medicine and Global Health, it was the public policy school, it was engineering, all working together to advance innovations in global health. Next slide. So you can see here a bit of a complicated slide to our approach, but basically what we did is we created a pipeline of innovations, primarily in Africa and India, but not solely. And we work with them for a 3-year period to really help develop their resources and capabilities and leverage impact investing opportunities for those enterprises that were investable. If you look across the bottom, different kind of swim lanes here, we actively sought to engage faculty and students in a wide variety of ways. We had a real intentional focus on being a learning accelerator, to harvest our lessons learned and knowledge to share with practitioners, policymakers, funders, and others, and a real kind of keen focus on assessing our impact. Next slide. Just a few key kind of outcomes of that accelerator were, our enterprises reached more than 29 million beneficiaries in more than 50 countries. With our support, our innovators raised over $55 million through more than 2,000 connections we empowered. We developed a wide variety of tools and materials, and then we embraced and engaged over 200 students through internships and consulting experiences, as well as consulting clubs and other things, and more than 500 students in a series of different innovation efforts. For example, when Ebola hit, we did an Ebola innovation challenge. And the next year when Zika hit, we did a Zika innovation challenge, really to get students to become kind of a hub around innovation, service learning, civic engagement, global health, and other areas. So as we reflected, that ended in 2012. As we reflected on some lessons learned, next slide, you'll see kind of a few key things that we thought were helpful that make learning accelerators such a promising model for universities, and certainly with different stakeholder groups. So for example, with our social innovators, we were really able to bring kind of the best of the university to support the building of their capacity to scale impact. We helped them think about more sustainable business models and in fact achieve greater impact in their work. With students, we thought about kind of 4 key areas: inspiration, inquiry, engagement, innovation. So how do we inspire our students through speakers, events, classes, co-curricular activities? How do we invite them into inquiry and research methods to apply their disciplines? How do we engage them directly with the social innovators, but also with other stakeholders? And then how do we spur their ability as innovators, critical thinkers, and problem solvers? For faculty and staff, we saw a number of benefits, research opportunities and engaged scholarship for them to draw upon their efforts. We were able to fund several faculty in their own research initiatives. We were able to engage others with our innovators. Certainly, we helped support teaching through speakers, case studies, and insights, advising, and then thought leadership. Through our efforts over 5 years, we were able to publish a number of papers, findings that were, I think, helpful to the field and so forth. And then finally, we really engaged in kind of ecosystem development by engaging with funders, investors, donors, a wide variety of actors, really building the field of global health innovation, but also achieving a greater scale of impact collectively. How do we work together to move ecosystems? Of course, it takes an ecosystem to scale impact. So we did that kind of broadly, globally, and also within East Africa and India. So these are some of the lessons learned that we think make accelerators a promising model for universities, depending on the SDGs you're focusing on and your own kind of domain expertise. So I'd love to turn it over to my colleague Krishna to share a little bit more from his perspective in global health about some of their experiences drawing upon this approach. So Krishna, over to you.
Thank you, Matt, and good afternoon, good morning to everyone. Pleasure to be with you. Matt told you about the breadth of the ecosystem around social innovation entrepreneurship at Duke. I want to tell you a bit about the depth that we have in a particular domain, and that's in health. So part of what we realized very early on is that a university is a powerful organizational construct under which to undertake this work, but has to be part of a broader ecosystem, exactly like Matt said. So in addition to partnerships, we actually 10 years ago created our own nonprofit called Innovations in Healthcare, jointly between Duke, McKinsey & Company, the management consulting firm, and the World Economic Forum, in many ways to act as the effector arm, to be in the field operating and trying to actually do the work and support actors, while at the same time being a university and having a global health innovation center that allows us to generate stronger evidence, policy analysis, and undertake our education and training. The next slide, you see that the three big areas where we really focus our work. First is on how do you source and help to directly and indirectly scale the most promising innovations in health and healthcare around the world, whether these are interventions, programs, or enterprises. The second is really around how do you create partnerships, increase the ecosystem, and create the health system's capacity to scale effectively. And the third, especially grounded in our academic mission, how do you generate and share insights, knowledge, and move the field forward so that part of our scaling strategy is, in fact, not just to directly support innovators, but to generate insights that many others can use over time. Looking at the next slide, you'll see part of our approach through the nonprofit has been to curate a network of leading social enterprises. These are small and medium growth stage enterprises that are providing health services, technologies, and financing. So we have a network of 104 such enterprises across almost 100 countries now. They in turn are serving more than 40 million people annually. So this gives us both a pulse on the cutting edge of innovation that's happening in health and healthcare in low and middle income countries, but also serves as an enormous valuable platform for education and research opportunities. If we go to the next slide, you'll see that in addition to the work that we did jointly with CASE and other groups at Duke through the Social Entrepreneurship Accelerator at Duke, as Matt noted, we've since launched other multiple programs, one being an accelerator model, where we worked with the Saving Lives at Birth Grand Development Channel. 8 different development organizations and countries around the world had come together to fund over 100 interventions intended to improve the lives and health of mothers and newborns. And we were able to curate the most promising cohort from that program. And over the 2 years that we worked with that cohort, bring together a consortium of 7 implementing partners located all over the world to provide accelerator services, but to do so as a learning accelerator because we're a university, to generate and share insights more deeply. If you go to the slide, you'll see that some of the insights that we were able to develop and share have really been about improved practice. So we try to improve policy, we try to improve data, but we also try to improve practice. So we've created frameworks on how to assess and think about scaling strategies. We've created white papers on how to have social enterprises think about sustainability and health, and also think about market demand, which is a key change need that many enterprises in the health sector, at least, don't spend enough time thinking about. In addition to the accelerator pieces of this work, on the next slide, you'll see that we've also been asked, because we're an independent and credible research institution, to take on an evaluation component. In this instance, we evaluated the 9 years of a grand challenge to understand what worked well and where there are opportunities for improvement. And you can see that for the Saving Lives of Birth Grand Challenge, the 3 main recommendations that we provided were: 1, to figure out in a more precise way and across all the partners specific goals and metrics for success over time. The second is making sure that innovation is more demand driven, so that there's a stronger perspective and ownership amongst low and middle income country based stakeholders that are driving the entire innovation platform. And third, recognizing that what we often talk about as scale is very far from actual sustainable scale in the real world. So making sure that there are downstream handoffs and activities to enable enterprises and innovations to scale effectively. On the next slide, you see that while we're deploying our research and policy capabilities, we also work really hard to embed education opportunities across all of our programs, from undergraduate to graduate students across multiple programs, whether it's in the medical school, business school, or public policy, to find both curricular and extracurricular opportunities in the curriculum. We've worked with Matt and with other faculty like Professor Dennis Clements to develop global health innovation and entrepreneurship courses that link student teams to the innovators in our innovations in healthcare network, so that the teams are working with innovators, leading social enterprises on the ground and understanding the real context and serving as resources to help solve challenges in real time. And we also have summer internship opportunities where we're able to do field work and placements so that students get deep engagement into the social enterprise health innovation field. And we've now seen dozens of career development opportunities where these students have come out of here, ended up working at social enterprises, at development organizations like USAID, and at major nonprofits around the world. So this is a quick overview of how we've been part of this broader ecosystem at Duke, but able to channel work around social innovation and entrepreneurship deeply into the field of health and healthcare. I'm going to turn to my colleague Taylor now to tell us a bit more about the UNICEF Duke Accelerator.
Thank you, Krishna. Yeah, absolutely. Like the accelerators at Duke before it, the Duke UNICEF Innovation Accelerator is a pioneering partnership that aims to identify and scale sustainable solutions to the world's most pressing challenges. For this partnership, we are focused primarily on the impact for children, specifically across Africa, and focused on progress in Sustainable Development Goal 6, which calls for clean water and sanitation for all. The accelerator is funded jointly by the U.S. Fund for UNICEF and Duke, so that's kind of an interesting partnership triad that we have between Duke, UNICEF headquarters, and UNICEF USA. We are currently in the process of wrapping up our support for our first cohort. So we're a fairly new accelerator at Duke. And that first cohort consists of 6 social enterprises. And we are ramping up support for our second cohort, which consists of 7 social enterprises. And they are all working across Africa towards impact, in SDG 6. So social enterprises are selected to participate in the Duke UNICEF Innovation Accelerator based on their potential to scale and their potential to scale their impact for children. Each year, we call for applications through UNICEF and through UNICEF country offices, as well as through an open call. And a committee of Duke and UNICEF colleagues make the selections for each cohort. And we've really, with the Duke UNICEF Innovation Accelerator, we've taken lessons learned from all of the accelerators before at Duke. And so, having Krishna's insight and Matt's insight into developing this specific accelerator has been key. So our intended outcomes for the accelerator is really threefold. We want to really increase the effectiveness and scale of the innovators we support. We work to increase the ability of UNICEF to select and support innovations that they might not otherwise have access to, given just the scale at which UNICEF works and the sheer number of children that they work to support. They might not have eyes on the ground like we are able to do. We also at Duke are trying to increase our impact through transformative learning. We really engage students in the work of our innovators and in the work across our cohorts. We engage in research and thought leadership. Kind of going back to UNICEF, as Matt said earlier, social enterprises are really learning laboratories for society. So being able to utilize our expertise at the university to enable UNICEF to gain access to some of these social enterprises is really an interesting part of the partnership. So our objectives with the accelerator are really to build that pipeline of social enterprises for children and for UNICEF, to strengthen the innovators' capabilities who we work with to achieve increased impact wherever they're working. Of course, to support UNICEF's internal capacity in innovation and entrepreneurship. And like we've said, we actively engage students and faculty in all of this work. So once a social enterprise enters our accelerator, they kind of go on this journey with us. And our aim is to move these social enterprises further along their innovation pathway. So our focus is taking them from proof of concept, if that's where they are, to exploring how they can transition to scale their impact more broadly, and really increase their impact. So each year, as we've mentioned, we select a small group of innovations with the potential to scale, and we provide them with support over the course of 2 years. So each cohort is with us for 2 years of support. And this includes 5 main components: skill building, coaching, mentoring, scaling grants, and ecosystem building. So in our first 2 years of the accelerator, we've designed and led over 20 skill building webinars for our innovator teams, focused on the key elements of innovation and entrepreneurship, or essentially what it takes to succeed to create lasting impact. So that they feel that they have the capacity to truly do their work. Then we coach each of our innovator teams in refining their business plans and models. We talk about their theories of change. We work on their plans for scale. We leverage, how to leverage their ecosystems, and we leverage our own ecosystems to support them. How to tackle fundraising and get their pitch ready to go. We do this in an effort to, again, build their capacity and make them as confident as they possibly can be in their work. What we do is all of this leads into a capacity building plan that then triggers the release of the capacity building grant. So it's, really a lot of accelerators do come with that capacity building grant, but being tied to a university, that is actually kind of unique. So it's been really great that we've been able to provide basically unrestricted funding for scale for all of these enterprises. As a team, we use those capacity building plans to guide how we coach and match them with resources to scale. So we utilize our vast networks at Duke, across UNICEF country offices, to connect them to the resources that they need to succeed. This then helps to strengthen the broader ecosystem of social entrepreneurship and international development, and also, connect our innovators to networks that they might not otherwise be connected to, particularly UNICEF and UNICEF country offices. So our focus areas for the first two cohorts were, again, completely aligned with SDG 6. So our first cohort, we really focused on menstrual health and hygiene. In our second cohort, we expanded that to include sanitation and hygiene. And we've been working across these countries in Africa. So to dig a little bit deeper into our first cohort on menstrual health and hygiene, we selected 6 social enterprises. The innovations range from menstrual health apps like Oki, which is a period tracking app made for girls, with girls, or Lily, which is a health advice app. We have innovations in menstrual products. Kusoli Secrets has the Glory Pad, which is a hygienic and affordable menstrual pad. And Sakode, based out of Burundi, created the Agateka pad. And this is a really interesting innovation because it's a menstrual pad that can be worn without underwear. It is attached using strings so that underwear, which is a luxury for many, is not necessary. So that's been an incredible innovation that we've worked with. We also have FEM International, which works on the last mile distribution of menstrual products, and Thai Tanzania, which does animation and health education. And they're very, very, very cool. And in our second cohort, these are innovations focused on selling safe and affordable wash products with Wow Mom in Kenya. They innovate child-friendly toilets in Nairobi. We have Toilet Pride, who creates access to toilets in Nigeria, and Kidame, who brings the last mile in wash products, brings wash products to the last mile in Ethiopia. And TieUp is a really interesting organization that has created a hand washing station that they then sell to schools and provide wash education to students. Smart Girls, based in Uganda, is a social enterprise that has created the Smart Bag, which is an all-in-one backpack for girls, and it includes menstrual products, soap, and also a solar-powered lamp so that they can light their way to latrines at night or, use it to study. So both of our cohorts really are doing incredible work, and we also have one other in our second cohort, Eco Soap Bank, and Sanovation. Eco Soap Bank recycles unused soap remnants from commercial manufacturers and uses those remnants to provide soap to under-resourced communities across Africa and actually across the world. And Sanovation creates non-sewered sanitation solutions for second-tier cities in Kenya. And they're working to scale beyond Kenya, as many of our innovators are. And, we are based at Duke, and we have a wide variety of partnerships across the campus that help us support our innovators. And we also leverage our students. Many of our students work on special projects with different members of our cohorts. They engage in consulting opportunities with our innovators, internships, or they do research directly with our cohorts. So we engage the campus and our students in a variety of ways. We've also started an annual tradition of the virtual forum on social innovation hosted at Duke. And this is an annual event. It's a week-long event. We bring together voices and insights from around the world, from academia, INGOs like UNICEF, business and social enterprise, all to deepen the conversation around the Sustainable Development Goals and social innovation. And our second forum is coming up, so please mark your calendars. It's from October 25th to 29th. We are working on our RSVP, but you can use that link to save the date. So yeah, we've got a lot going on with the Duke UNICEF Innovation Accelerator, and it's all really exciting. If you'd like to learn more about the Duke UNICEF Innovation Accelerator, you can go to dukeunicef.org. To learn about any of the other initiatives that we've talked about today, you can click on any of these links, and I will, of course, add them to the chat. And we also have this QR code, so feel free to snap that, and we'll share that link in the chat as well. So we have plenty of time for questions, which is really exciting. You've heard from, the three of us on all kinds of different accelerators from the Duke University perspective, and how we engage students and partner across campus, particularly with the focus on the SDGs. So, let's go ahead and open it up for questions. And Matt and Krishna, please feel free to jump in with any additional comments or anything like that. So let's see if we've got anything in the Q&A. Let's see. Yep, thanks guys for sharing all of those links. Fantastic. And does anyone have any questions? It's tough, we can't see the audience, but we do know that you're out there. So please feel free.
Let me start with a question. We'll see if others come in. Krishna, I mean, you represent an interesting part of Duke where you're both affiliated with the Duke Global Health Institute, but also you have Innovations for Healthcare, which is its own 501c3 nonprofit. How have you been able to fund this work of yours in the past decade or so?
Yeah, thanks, Matt. And I think part of the value of thinking about this from a hybrid organizational model is really the sustainability lens to it. There are some things that universities are very good at and traditionally moving forward in as a leading edge of things like research, policy, education, training. And so the main resources that support our center within the university are traditional research grants, contracts from the U.S. Federal government, as well as from major foundations like the Bill and Melinda Gates Foundation and other sources like that. On the nonprofit side, we tend to have much more of an engagement model where we are having real world engagement. And there we have clear ability to work more strongly with foundations around the world, as well as with the private sector. And so that allows us to think about complementary financing models, complementary access to resources that are built in order to be synergistic as opposed to be competitive. So there are things that clearly are in the traditional mission of a university and things that are connected to but are slightly outside. So the fact that we can deploy both a university center as well as a university hosted nonprofit in parallel, I think allows us both to have more impact collectively, but also to think about sustainability in a more broad way.
Yeah, I'll share. Appreciate that, Krishna. I'll share that our first, the SEED program was funded through a cooperative agreement with USAID, but we agreed to a 1-to-1 match. So with every dollar that came in from USAID, there was either additional resources that we brought in through Duke, some of our time, for example, that was not covered, resources we leveraged, alumni, others, programs that we brought in. The Duke UNICEF Innovation Accelerator, the interesting approach we took there, it's a 50-50 split. So the U.S. fund for UNICEF has raised money from their supporters, and then we've leveraged our alumni network through the Duke Innovation and Entrepreneurship Initiative. Alums love to see students engaging with social entrepreneurs, and so we've been fortunate to have some very generous alumni who've been able to underwrite our costs for this program, which has really allowed us to do this in a way that's been so exciting, and allows us to bring in these students who are so eager to roll up their sleeves and get involved. And so that's how we've been able to do it.
Fantastic.
And Matt, I know, we've both kind of alluded to this, but there are a lot of lessons learned from your experience with SEED, and all of that when we were, building the Duke UNICEF Innovation Accelerator. Can you speak to kind of that experience a little bit more and how, how you, because you're really the architect. So
yeah, well, the thing is, and it was a team. It was definitely a team that came together for that. But one of our observations had been early before we launched SEED is that too many incubators and the term accelerator was coming into use back in 2012. I had originally proposed it back in 2006 before people thought of accelerators as a thing, because I was thinking, how do you have a program that scales impact? And so by the time that came about, too many of these were short-term programs, where an innovator would come into an incubator and accelerator for 6 months or whatever. So one really important insight was the need for a longer term engagement that went on to several years. And with SEED was 3 years, with UNICEF is 2, to build the understanding, the relationship, and to really help achieve impact. That was really key. And another real insight has been the importance of peer learning. So yeah, the innovators are excited to learn from faculty and have students engaged, but a real value is what they learn from each other. So building into these programs, opportunities for the innovators to share lessons learned, reflect on, and support each other. I can remember one time Krishna and I and the SEED team were at dinner with with the innovators when they were at Duke, and two started talking over dinner and said, maybe we should collaborate on this. And out from it came a collaborative effort, So that's been really key as well. I think another one has been, engaging faculty can be challenging, quite frankly, unless it aligns with their research interests or their service and teaching. In the SEED program, we did have some additional resources that could fund some research by faculty. That's often hard money to get. And at times, the research interests of the faculty might not fully align with USAID priorities, but having those incentives were really useful to getting more faculty engaged, and having a kind of a governance mechanism that engaged a number of players from across the university, I think was also key. And then finally, I think, besides just the synergies that you could create across the university, taking time to document the insights and share them broadly by speaking at conferences such as this one, by putting out white papers to really help harness this knowledge for the benefit of others. I think there's some of the key. We have a whole paper on lessons learned, and I'll try and put that in the chat in just a moment.
Yeah, having worked for other accelerators, completely separate from the university system, it's just such a unique model. Because when you're a standalone accelerator, you're able to push, whatever interest or agenda happens to be happening at that moment, but you don't have the same access to experts and research and students and, all of those things all in one place, like you do at the university. So, you could be a standalone accelerator and be doing really, really great work, but it's harder to form those partnerships naturally than I would say at the university. Krishna or Matt, I don't know if you have any thoughts on that.
Yeah, completely agree. I think in many ways universities serve as trusted third parties easy because they don't have a particular point of view, so can really serve that purpose to bring different stakeholders together in a trusted way.
Yeah. Agreed.
Great. I think we are at time.
We are, in fact, and there is a climate conversation happening on the main stage, so I believe folks should be heading that way. Thank you, everybody, for your time and attention. Matt and Krishna, amazing to spend this time with you. Thank you. For follow-up,
Thank you.
Yeah, feel free to reach out to any of us. You've got all of the links in the chat. So thank you, everybody.
Thanks, everybody. Take care.
Fantastic.
Enjoy the rest of the conference.
Bye, all.